Have you ever felt like there's something stuck in your throat that just won't go away no matter how much you swallow, cough, or clear your throat? If so, you're not alone. Many people deal with that annoying, lingering sensation of mucus in the back of their throat every single day. It can be uncomfortable, distracting, and even embarrassing at times. But what's really going on when it feels like mucus is constantly building up? If that's the answer you're looking for, keep watching because this video breaks down the most common reasons behind that uncomfortable feeling and explores what you can do to finally find relief. There are several underlying causes, and identifying the root of the problem is essential for effective treatment. One of the most common reasons for this sensation is postnasal drip, which occurs when the nasal passages produce excessive mucus that drains down the back of the throat instead of exiting through the nose. This is typically triggered by allergies, sinus infections, or colds, where the body produces more mucus in response to inflammation or irritants. Seasonal allergies, for instance, can cause a persistent drip that leads to throat irritation and a constant need to clear the throat. Environmental allergens like dust mites, pet dander, or pollen often worsen these symptoms. Another major contributor is gastroesophageal reflux disease, or laryngopharyngeal reflux, in which stomach acid travels up the esophagus and irritates the throat. Unlike typical acid reflux, laryngopharyngeal reflux doesn't always cause heartburn, so people may not realize that acid is affecting their upper airway. Instead, they experience a chronic lump in the throat sensation, hoarseness, or the need to frequently clear their throat. The acid causes the throat to produce protective mucus, which can accumulate and feel like it's stuck. Chronic inflammation or irritation from smoking, exposure to air pollution, or inhaling irritants, such as chemical fumes or dust, can also stimulate excess mucus production. Similarly, dehydration or dry indoor air may cause mucus to thicken and become harder to clear, making it feel like it's lingering in the throat. In some cases, habitual throat clearing or excessive coughing in response to the sensation can actually worsen the problem by irritating the tissues further, creating a cycle that perpetuates the discomfort. Less commonly, structural abnormalities or neurological issues affecting swallowing or sensation in the throat may also lead to the feeling of retained mucus. Additionally, chronic respiratory conditions such as asthma, chronic bronchitis, or upper airway cough syndrome can contribute to mucus buildup or altered mucus sensation. To find relief, it's important to treat the underlying cause. For allergy-related mucus, antihistamines, nasal corticosteroids, and avoiding triggers can help. In cases of reflux, dietary changes, avoiding late meals, and acid-reducing medications may be effective. Staying hydrated, using a humidifier, and avoiding throat irritants can also ease symptoms. If the sensation persists despite these efforts, it's a good idea to consult with a healthcare provider or an ENT specialist to rule out more serious conditions and develop a targeted treatment plan. But as previously mentioned, dealing with a constant sensation of mucus in your throat can be frustrating. But understanding the root cause is the first step toward finding lasting relief. Whether it's due to postnasal drip, acid reflux, allergies, or another underlying issue, there are effective treatments and lifestyle changes that can help ease your symptoms. If the problem doesn't improve or starts to interfere with your daily life, don't hesitate to reach out to a healthcare professional for guidance. With the right approach, you can finally put that sticky, uncomfortable feeling behind you and breathe easier for good. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Have a nice day, and thanks for watching.